So who are the guys driving up plastic surgery statistics who actually get their faces done? To find out, I visited a plastic surgeon named Brannon Claytor.
Hey Liz,
Hey.
Claytor, how you doing? Well, come on in here and drop
Thanks.
Brannon runs his own practice in Media, Pennsylvania. It's a well-heeled suburb near Philadelphia.
I can be injecting Botox in here. That's a very comfortable chair.
And he says he's definitely noticed growing interest among men.
This trend has been going on for more than 4 years, and it's just growing.
Brannon says about 15 to 20% of his patients these days are male.
They are fathers, they are business owners, they are successful professionals, somebody that is very comfortable with themselves, but feels that there's this one little area they'd like to just tweak. Certainly, one of the leading procedures we do is facelifts.
He says a lot of male patients also come in to get rid of double chins, otherwise known as turkey waddles, and for blepharoplasties, a procedure that lifts droopy eyelids.
And it can really make you look like you've just had your best night's sleep.
Brannon says he's not sure what's driving this growth in men getting plastic surgery. There aren't any studies on it yet, at least none that we could find, but he has a few ideas. And his number one suspect? Smartphones.
Effectively, people are walking around with a mirror at arm's length all the time.
A mirror that can take pictures and post them instantly to social media.
There are many, many more photographs being taken and shared immediately. Patients will come in and say, I hate being in these photographs because my neck looks so bad.
So think about it. As a guy, you may have gone from literally never thinking about your droopy eyelids or saggy neck to suddenly having it shoved in your face all the time. Another big reason Brannon thinks more men are getting cosmetic procedures done is that people are living longer, which means they need to work longer too.
They are not ready for retirement, but people are starting to ask them and say, when are you retiring? And so they come to us saying, I really want to be able to project that youthful persona.
So what do Brannon's patients say about their reasons for going under the knife? I decided to ask one. Bill Strohauer. He's a weight loss physician.
Weight loss and weight control. We see the cheaters, angels and martyrs don't need to be here.
As you can probably tell, Bill is kind of a quirky guy. He's thin with glasses, cleft chin, and strawberry blonde hair. But a couple years ago, when Bill looked in the mirror, he didn't see any of that. Instead, he saw this.
This is your turkey neck, I guess, and, I couldn't get rid of it.
Bill was about to turn 70 and feeling depressed.
Yeah, it's even hard to say the age.
For him, getting older means the end of things.
There's nothing really to expect. You usually end up checking the obituary pages. That's about it.
So Bill decided to take some measures. He started by taking dance classes.
I don't know. I said, teach me to dance like Antonio Banderas, the tango, that, and Patrick Swayze in Dirty Dancing, The Last Dance. I like that too.
And ahead of his birthday, he decided to cheer himself up with a facelift.
I figured, I have to look in the mirror every morning, and if it's going to make me happier and more motivated to do things, then I will.
A year and a half later, his face still looks pretty good, relatively smooth and no flabby skin hanging under his chin.